What are you gonna do?
What's up, you guys? Welcome, low back fixers, and everyone that wants to be one. Pretty much in a lifetime, all adults will need to help their low back in some capacity. So everyone should be listening, right?
Tune in.
Tune in.
Put the Smackdown on the Stenosis. That's what I just named it.
That's good. Put the Smackdown on it. So today's topic is stenosis. And you are not your diagnosis of stenosis.
Ooh, rapping.
That rhymed.
We're rapping.
For those of you that don't know me, Dr. Theresa Larson, I'm a physical therapist, and this is...
I'm Anders Varner, strength coach, teaching you that you're allowed to lift weights and move and do all these things. Rest is not the answer always.
No.
Movement.
It's good to have rest days.
Movement is the answer.
Yeah, so we want to have a little conversation about stenosis, and Anders and I are going to kind of go back and forth about some movements and ways to set up your spine for different for lifting, right? There's 5 key movements of life. We've got pushing, we've got pulling, we've got squatting, we've got hinging, we've got carrying. So those things you can do with a diagnosis of stenosis. But what I want you guys to
I'm never going to get over that.
Hashtag diagnosis of stenosis, but you are not that. So today I want to kind of disclose the myth of what stenosis, tell you what it is, and tell you things that you can start doing to help it, right? We sometimes get these diagnoses from the doctor. So first and foremost, we go to the doctor when we have pain, and the doctor says, okay, you got a spinal injury to the base of your spine. Usually stenosis happens at the bottom of your spine. So bottom of the low back or bottom of the neck. So the bottom parts of each aspect of, there's 4 different parts to your spine. So usually the cervical and the low back that need the most mobility, that's where, or the most stability I should say. So cervical spine and low back need the most stability. That's where the stenosis usually happens, right? The bottom of those pieces. So bottom of the neck, bottom of the low back. Now, so a doctor tells you you have stenosis, and might tell you, you know what, you should stop squatting, you should stop lifting weights. Basically, walking will be your best activity, or resting, wait till the inflammation goes down, or take these medications. Take this medication, and they won't give you any exercise or movement advice. And to be honest, a doctor doesn't have necessarily that background. Oftentimes they're not trained in movement therapies. Right? They're just trained in medicine. That's why they call them a medical doctor. So what I want to tell you though is stenosis is a common diagnosis, but it's not a normal one. Okay, all these pathologies that happen to our spine are not normal. We're designed, and especially when they cause pain. When they've gotten to the point where they cause pain, that means somewhere along the line, the spinal segment, you know, the tissues around the spine, your movement patterns, your ability to move well has gone awry. And so now there's a pain, now you have pain, and your brain is telling your body there's a threat. So here we go. You get this diagnosis, you're like, what the heck? You love to lift weights, you love to move. Your doctor tells you to stop doing that, or your healthcare professional. What do? Well, you go online, you go on Google, and you look up stenosis, and what does it do? It probably scares you. What you're going to find is that it says stenosis is a narrowing of the spinal canal. So you have basically this long tube, right, that goes down your vertebral column that holds the spinal cord. And you also have little holes that go out each vertebrae called foramen. And sometimes because of degenerative joint or arthritis or just tissues getting stuck, joints getting stuck, that hole can start to get smaller. So then it starts to encroach on nervous tissue, like the spinal cord, as well as, doesn't Anders' face look so bright?
Our lighting is sort of professional-ish.
It totally is.
Sort of-ish.
We've got some professional lighting going on here. So it makes my skin glow.
It's hard. It's the first time it's cloudy in San Diego, so we don't know what to do with the lighting.
What do you want? How do you want to help your skin? You just
fake
put a light on it.
Fluorescence.
So.
Oh, there it goes.
Now even sweet.
So pro.
So thank you. Much better now. I look like an angel again. Okay. So where was I?
Foramen.
Foramen, right,
Yeah.
foramen. So these holes can get encroached because of this degenerative tissue, which can happen in the joint space of the spinal canal or the foramen, where the nerve roots go out into what we call in the neck area, it's the brachial plexus, and then in the low back, it's the lumbosacral plexus. So essentially over time, right, how do these encroachments happen? How does this narrowing happen? You're like, oh shit, the spinal canal, spinal cord, where the spinal cord is held, that's a intense area. Like, when you see that on the internet, it scares most people. And what I want you to know is that, yes, you want to respect the fact that you have this diagnosis, but you also want to know that your body is extremely resilient and wants to move and wants to heal and should not, and doesn't need to be in pain, even with this diagnosis. So the things that you can do, let's just actually first talk about why this happens. So it doesn't just happen overnight. So a lot of times I get someone that comes in, and stenosis is typically with someone a little bit over the age of 40. Sometimes younger people get it, but typically it happens in people over the age of 40 when discs have started to become more, less viscous, they become less like a jelly donut and more stiff. And so over time, you know, and so as we get older, the disc space starts to get a little bit stiffer, and our posture, based on the postures we hold, we might sit in a stiff position, we might not move as much. Our sedentary life might cause this encroachment, because our body, our tissues are going to adapt to the positions we hold. The people that I see in my office are very active, some are older, and some have this diagnosis. And so you wonder, okay, if I'm not sedentary and I have this diagnosis, what does this mean about me? Well, it could mean, if you can point the video camera down a little bit, Anders. So pelvis-wise, so if someone is constantly in this overextended state, pelvic state, or constantly flexed, let's say sitting at a computer, or like I said, overextended, maybe they're a former fighter, athlete, right, gymnast, that's not so awesome for the low back. And that can cause narrowing over time. Because if you get stuck in those postures, extended or overly flexed, that's...
Oh, our thing died. Man,
we're good.
All the things today. All of them.
This is what makes us resilient.
Right? How did that happen? There we go.
We're back.
We're back. It was this piece. I don't know what that is.
It's always one piece.
You know? We have better lighting now, though.
We do. I'm back to glowing like
go.
an angel. So long story short, you get this diagnosis, you look online, it can be scary. But know that it doesn't just happen overnight. Look at the postures that you hold during the day. Look at how you hold yourself, look at how you lift, right? If you're not able to maintain a neutral spinal position, not just lifting, look at how you hold yourself all day. If you're not in this neutral spinal position, which neutral spine is this, so butt is gently squeezed, pelvis is not completely flexed or completely extended, you're somewhere in between. Those ribs are down, shoulders rolled back. So your spine is now stacked, right? You have a nice curvature in the low back, a nice curvature in the mid back, and a nice curvature in the neck, right? You don't want to be completely flexed or completely extended. That is going to be more of a risk, a fault, for creating these kind of things, these events that can cause a narrowing of the spinal canal. So, of course, there's the trauma that can happen too, but that's very rare, right? So if you've been in a car accident, that can also cause someone to get this diagnosis, but that's more rare than things that just happen over time because of poor posture, poor lifting posture, poor moving posture, or just being sedentary. So how are we going to fix it? So these are the things that we can do. First of all, you want to find out, are you flexion or extension biased? Most people with this diagnosis definitely are going to be more flexion biased. They're going to enjoy being in this position more. They're going to enjoy sitting in a recliner just because of the pressure.
And recliners are awesome.
Recliners are awesome. So, if you look here on Anders will be my demo. So, and I'm just going to bring this. So I'm going to explain it while Anders does it.
Hope we don't.
We're okay.
We don't break.
So So if you look at Anders from the side, we see you on there?
Yeah, we're good.
Okay. So notice, so go ahead and extend your pelvis. So stick your butt out. Yeah. So in his pelvis right now, what he's doing is closing down tissues in his low back. We call that kissing spinous processes. That's not so awesome for his back. And what that's gonna do is actually close off areas. So there's little foramen that come out.
You're not on.
Not? Okay, here we go. There's little foramen that come out of the vertebral bodies where nerve roots come out. He's going to be closing those down by extending his posture like that all the time. Now go ahead and completely flex your pelvis, tuck under. Now, for someone who was in that previous posture, this is going to be way more comfortable. We see you okay, everyone?
Good.
Okay, cool. I'm totally a videographer, so stay there. Good job with the tucking the pelvis even more. There you go. So this is a nice posture to help give relief to someone who is constantly in that extended state who has the diagnosis of stenosis. All right, so thanks, Anders. That was perfect.
Nice. Teamwork.
So, yeah, teamwork makes the dream work. I'm going to say a couple more things about that. So I'm just going to stand
Sorry.
there.
We're here.
We're in the
We're in the
main
clinic.
lobby
Yeah.
of your movement prescription and Movement RX. So you guys saw Anders' pelvis. It was a little more flexed, that second position. That is a much more comfortable position with someone who has stenosis, because typically this extended posture is what they're used to, right? And they lift like that too. And whether it's you're a lifter or not, typically that extended posture is something that you are in, and flexion is going to be your friend. So doing the things that Anders just did, that small just tuck of the pelvis, is super simple and easy to do. And you can do that during the day. So literally, when you're sitting, tuck your pelvis, squeeze your butt, let it go. Tuck your pelvis, squeeze your butt. You can do that in standing too. Tuck your pelvis, squeeze your butt. Now, the next thing is, I know there's just, he's my tester today, because a lot of this stuff is it's complicated to understand, and it's also complicated to sometimes explain. And the cool thing about what we do, you guys, just a little preface, side comment, is that we don't want you to focus on these scary diagnoses, because we want you to know that your movement is the way you can heal these things and actually become pain-free. You might not actually cure the stenosis, but you're definitely going to make your spine healthier. Right? We can't guarantee that, but we can guarantee that you can become asymptomatic over time. With that being said, okay, so you've done these pelvic tucks. All right, that feels good, but you want more. So go ahead, Anders, why don't you go ahead and try. I'm going to do this demo with you again. Just do a couple toe touches for me.
All the way down?
All the way down.
Am I doing it?
So all the way down, tuck your pelvis, and then come back up. So notice, Anders, just go ahead and do 10 reps for me. So he's going to go ahead and do 10 reps. Notice his pelvis is rounding, his low back is rounding. You can bend the knees a little bit if you need to, totally fine. But what's happening is the spinal column is opening up. So the back part of his body that was, let's say he had pretty extended posture, is now opening up. He's creating space in those foramen. Good. So that's one way. Now, put your hands on your hips, Anders, and face us. Good. Now go ahead and shift those hips side to side. Do like the hula dance. Yeah. So Anders and I like to do hula dancing. I just talked to someone who's a hula dancer the other day. We're going to bring hula hoops in the office. No, so go ahead and do that 10 times, just side to side, and I'll explain. So what you're seeing Anders do is he's side bending. But where's he side bending from? His hips. So he's moving his hips to the left and then to the right. And what's happening is, so stick to the left. So when he's going to the left, he's actually opening up the left side of his body, right? And the left side of his vertebral column. Now go to the right. On the right side, he's also opening up the right side of his vertebral column. Okay? So now go ahead and twist your hips as I twist the camera too. Yep, and then the other way. So as he rotates to the right, okay, that's the left. Oh, yeah. I'm special. As he rotates to the left, he's opening up the left side. As he's rotating to the right, he's opening up the right side. So, stay right there, Anders. So as you do this, what I want you to do is test those. Bend over and touch your toes 10 times. Rotate 10 times each way, and then shift those hips 10 times each side. How does it feel? Does that make any difference? All the while, making sure, show the pelvis position, neutral pelvis position. So turn to the side for a second. So butt squeeze, rib cage is down. Make sure you have that position versus being extended. This is a no. And or completely flexed. That's also a no. Okay, so cool. Now, Anders, in terms of lifting and stuff,
yeah. How do we pick things up?
Yeah, so how do you maintain a neutral spinal position if you've always been extended your whole life?
So the biggest thing that when, like all of these diagnoses that when people come in and people get so connected to the actual name, it's like, this thing has a name and now I can connect with it. And it's something, it's like a trap that everyone falls into. And the biggest thing that we need to realize is like, you can start getting better without having this big scary strength conditioning plan or only seeing your doctor or going and getting pain meds and all these pieces that usually attach themselves to these diagnoses. And one of the things that I start everybody off with is we have to go through some sort of assessment, right? So like the very basics of what I just did, like can you bend over and touch your toes? I truly, like I'm interested in learning about your diagnosis, but it doesn't really matter to me. Like we're always going to start with some sort of movement assessment and understanding just basic ranges of motion. What is an optimal range of motion? And being able to bend over and just touch our toes is going to be the starting point for so many of us, right? If you can't do that, well, now we have to work on some of the bigger questions like mobility and stability in the tissues, understanding where these joints are and how we can kind of connect our brain and body. One of the biggest things that I feel like I'm fighting in my life all the time as a strength coach is the people that come in and say, my doctor's told me to do nothing. Well, the thing that bothers me the most about that is you're breathing right now. And the fact that you're breathing means that we can do things. You don't think ever about your breath creating movement. But every time we breathe, if you're doing it wrong, your chest comes up. And if your belly's moving, we can start to heal and downregulate some of this pain, some of the tissues, start to increase the range of motion, all these things. So if we knock movement down to its most basic level, the simplest thing that we can do is just focus on that breath. Not only that, but that's going to start working on neutral spine. We can start to create a neutral pelvis, all these pieces, and all we have to do is stand here and learn how to breathe properly. So when we're breathing, if you put your right hand on your belly, your left hand's gonna be on your heart here, just like the yogis teach you when you're getting all zenned out. If we can breathe into our belly and push against the hand that's on your belly, you're gonna feel that fill up with air. Breathe through your nose, you fill up with air down here, and then a little bit of air gets into your lungs. When you breathe out, it's going to go lungs, then belly. And as you breathe out through your mouth, you're gonna feel your abs tighten up. And what that's doing is just telling your brain that, hey, all that area around our low spine is protected. And just that simple movement, if we're able to do that, say 10 times in a row and have really good quality deep breaths, we're gonna be able to down-regulate some of the tissues, get into a parasympathetic state, a little bit of a rest and digest, so we don't have to worry and focus on this pain all the time, right? So there's never a reason why someone should tell you, do nothing, because doing nothing means you're dead. You didn't make it, you're not breathing. So the breath is the simplest piece that we can start with. From there, then we can start to add a little bit of movement, like the fact that you've made it into the clinic or you've made it into your coach, made it into the gym, whatever it is, you're walking. And very simply, we can start to move from there. So no matter what the pain is, we can always squeeze our butt and work on neutral pelvis, right? We can squeeze our butt, and then we can start to get into some of the more basic stuff that Dr. Theresa was talking about. How do we push our hips back to load our posterior chain, just making that brain and body connection? How do we squat, push, pull, hinge, carry? Things that we can start to add complexity to movement. So from the very basic level, can you breathe properly? Can you fill your belly up with air and brace your core? This is the easiest thing that we can start to do. You can do it where you're at right now. You don't need a gym, you don't need a doctor, you don't need a coach. Just learn how to breathe into your belly, and when you breathe out, contract your core, activate those deep core muscles, and be able to stabilize your spine. From there, neutral pelvis by squeezing our butt and keeping those ribs down. And now that entire low spine area that everyone talks about when we get into stenosis, that area is going to be protected, and we can start to add some complexities and start to get into some basic functional movement patterns from there. That's how we handle all this stuff. It always starts with an assessment. can you bend over and touch your toes? If you can't, we need to work on a little bit of mobility. If you go down and you're putting your elbows on the ground or palming the ground, it's too much. All of a sudden we've lost control of those joints, and we need to start working on some stability drills and really connecting your brain with these ranges of motion. So don't ever show up and say, my doctor told me to do nothing. Because the fact that you're typing that email to me or the fact that you're calling to me means there's air coming out of your body, and you should be doing something to help yourself. The great thing about this, Molly, if you want to put up the score that we were talking about, so we created this kind of score for everyone to get on here. It's just a lifestyle test to see what kind of diagnosis you're dealing with, and the complexities of that diagnosis. Like, how far along are you in the process? When were you diagnosed? What is it kind of taking away from your life and your day-to-day? You can fill that out, and what you're going to get is a specific plan of action. We've created this awesome program that's working wonders. We just finished a pilot program. We have another program working down here at the Navy. The results are coming back phenomenal. Functional movement screen scores, significantly less pain, just transforming people's lives. The way that we're able to do this stuff is by finding out these scores. We can track it over 8 weeks. You'll be able to see exactly what's going on, and we start with the most basic things. So working on the breath, exactly what we were just talking about. Then we walk you through an assessment, so you're getting the mobility and stability. You're taking these scores, or you're taking these assessments to find out, where am I at today? Do I need to be in 8 weeks? And then from there, we start to build in some of these functional movement patterns. Can you squat properly? It doesn't need to be a back squat. That's the last thing we want you to do. But what we want you to do is be able to sit down properly. So when you walk around, your posterior chain is activated. You're able to stabilize your spine, all these pieces. What we want to do is have you get in, take that score, so we can have a conversation and just that baseline of knowledge of, here's where I'm at today. Molly's gonna give you another link so you can set up a call with us, and we'll be able to walk you through this diagnosis so you can get an answer on what is a movement plan. How simple can we make this thing? I mean, literally starting with your breath can be so simple. It's such an easy way to start to relieve the stress in the tissues, start to move a little bit better, and understand how all these pieces create this like macro system instead of focusing on this micro little diagnosis.
That's a good way to explain it.
That mental and emotional connection that everybody gets when you give something a name. When the truth is we have this big movement problem. And it may be further down the line, you may have been dealing with this for a long time, but the truth is, like, if I can teach you how to breathe better, understand ranges of motion, and then get you to move a little bit better, we're gonna make significant advancements in your lifestyle, your enjoyment of your life, the fact that you can just go and do stuff. But don't come to me and say you can't do anything, because that's the worst. It takes away all the power. Like, you have the ability, you just need this learning program to understand, like, you can do this, and we're gonna be here to help you.
So one of the things you mentioned when it comes to diagnosis is not identifying with it. That's really crucial. Like, that's something that as a physical therapist, I see a lot of injuries, and Anders actually sees a lot of people that have injuries too. And it's frustrating when you come in, you have this diagnosis, you try an exercise plan, maybe a home exercise program for 2 days, you still feel pain, maybe it's getting a little bit better, maybe it's staying the same, and you quit. And then you just stop. So the thing about a program is that Anders and I put it together to give you something consistent for a matter of 8 weeks. Usually, all these musculoskeletal injuries that happen to the spine can be fixed and start on the right path in 8 weeks. Right? Some people, depending on how long they've had it, may take a little bit longer, but you have to know that it's time and consistency. It's a process, not a pill. And that's why we developed the Low Back Fix program. So why can someone with stenosis or someone with sciatica or someone with a bulged disc do it together? Because it's the area of the pain is not the cause. The cause is the fact that your low back is so tight you can't touch your toes. Your low back is so unstable that you can palm the ground. Your low back you've been so extended for so long, and lifting or in life or whatever you do, you're constantly extended in your pelvis, putting a lot of pressure on that low back, that it's not changing, right? You need time to change it. And just going back on a strength program to lift more is not going to help you. Like, you need mobility, maybe you need stability. And this program it's very individualized. So it's not like it's a one size fits all. But what we do know is that these assessment techniques that you're going to be tested on will tell you what you need to do to help yourself. And then you're going to have to take yourself through and do specific drills to help those. And we guide you through every step of the way. So
make sure you get in there. If you click on that second link right there, you're going to be able to talk to me, and I'm going to be your coach, and we're going to work this thing out. Because we get to set up these sweet little private Facebook groups. I get to watch videos and coach you. Dr. T gets to get in there and tell you how awesome you are, and it's a really good time. So take the score, set up a call. I'm Anders. I want to be your coach. Come hang out with me. Stop listening to people that tell you can't do anything, because I'm going to help you. She's going to help you. We're going to kick this thing's ass. I don't know if that's legal on Facebook Live. I hope they don't screen me.
It's fine.
If you have any questions, I saw one question come in about Lindy Barber. I have no idea about Lindy Barber's diagnosis. I wish I did. I think she does a lot of fitness at a really high level, but I don't know. Not legal. Sorry, that was another one. I don't know anything about Lindy. Except we can post an answer to that in the comment section. But most importantly, ignore that not legal sign. We're gonna stay legal. Thank you for hanging out. Make sure you get in, schedule a call, take the score so we have something to talk about. And we'll see you guys next week, where we are going to be talking about undiagnosed MRIs, disc disease, things of that nature.
Yes.
See you guys next
Anything
week.
that involves a disc next week.
Awesome. Thank you guys.
Bye.